What are the terrible side effects of long-term use of short-term contraceptives? As a menstrual regulation medicine and a regular method of contraception, short-term contraceptives are a good companion for many girls. However, when sorting out the background issues, we found that although girls are familiar with the effects of this medicine, they still have a half-baked understanding of its properties, common reactions after taking it, and side effects, and have doubts. In order to let girls take short-term contraceptives more comfortably and with more scientific medical knowledge, in this push we invited gynecologist Wang Xiaoyi to specifically explain several important issues about short-term contraceptives for everyone. In this issue, you will see: Oh, do you need to do checkups before taking short-term contraceptives? Oh, can you continue to take Yasmin with breast nodules? Some text goes hero after taking Yasmin, there is always brown secretion in the private parts? Some text goes here. Oh, will taking Yasmin cause thrombosis in the brain or discomfort in the liver? Oh, can short-term contraceptives be taken long-term? What are the side effects? Oh, can short-term contraceptives be purchased and taken on their own? Where can they be bought? Oh, do you need to do checkups before taking short-term contraceptives? In most countries, short-acting combination contraceptives are over-the-counter medications, and the same is true in China. We can easily buy them at pharmacies without providing laboratory tests such as liver and kidney function, coagulation, and mammography. Despite most young women being suitable for using combination oral contraceptives and having good effects, if there are various health condition treatment and management issues, one must seek the help of a doctor to evaluate the safety and side effects of the drug. The World Health Organization has classified the ability to use low-dose combination oral contraceptives into different levels, and the following is an introduction to Level I. There are no restrictions on the use of low-dose combination oral contraceptives for women who have the following conditions. Age: before the onset of menstruation to 40 years old, excluding smokers. Body mass index and LT, 30 kg/m2. Obstetrics and gynecology conditions: history of ectopic pregnancy, history of pelvic surgery, post-miscarriage, early, midterm and infectious, lactation greater than 21 days. Irregular menstruation or dysmenorrhea, pelvic inflammatory disease, benign breast disease, uterine fibroids, cervical ectropion/cervicitis, now called cervical squamous metaplasia, endometrial or ovarian cancer, gestational trophoblastic disease, gestational diabetes. Chronic disease history: thyroid disease, epilepsy, hepatitis, virus carriers in non-active period, malaria, schistosomiasis, tuberculosis. Sexually transmitted diseases or HIV high-risk factors, condoms are recommended. Minor surgery but does not affect normal activity, varicose veins, mild non-migraine headaches. If the health condition is neither within the unrestricted range nor within the contraindication range, it needs to be evaluated by a doctor before a decision can be made about whether or not to take the medication. Going back to the question from the mother earlier, fibroadenoma and breast hyperplasia both belong to benign breast changes, and are classified as WHO grade I. There are no restrictions on using oral contraceptives. If you are generally healthy, you do not need to do any special examination before taking the medication, but for safety reasons, it is best to have regular physical checkups to timely discover health hazards and ensure safe use of the medication. Oh, can you continue to take Yasmin with breast nodules? We often saw BIRADs in the checkup reports. BIRAD stands for Breast Imaging Reporting and Data System. It is a system of classification for breast imaging developed by various professional organizations such as the National Cancer Institute and the Centers for Disease Control and Prevention. The classification is based on the imaging characteristics of breast masses such as shape, location, margins, and internal echoes, and ranges from 0 to 6. 0. Inadequate examination. Further imaging needed. 1. Negative. No abnormality seen. 2. Benign findings, usually recommended for follow-up every 6 months to 1 year. 3. Probably benign, with a malignancy risk less than 2%, usually recommended for short-term follow-up every 3 to 6 months and can be downgraded to 2 if no changes are found after 2 years. 4. Suspicious for malignancy, often recommended for biopsy or additional imaging. 4A. Low suspicion of malignancy, 2 to 10%. 4B. Intermediate suspicion of malignancy, 10 to 50%. 4C. High suspicion of malignancy, 50 to 94%, but not meeting criteria for 5. 5. Highly suggestive of malignancy, on 95%, treatment options should be considered. 6. Malignancy confirmed, but treatment not yet started. Regarding the question in the text, a third-degree breast block has a high likelihood of being benign and requires regular follow-up, but if its size changes, further evaluation by a specialist, breast surgery, is needed. If it is benign, oral contraceptives can still be considered. As for side effects, all drugs have the potential to cause side effects, and no test can predict the occurrence of side effects. Clinical doctors generally evaluate whether to use drugs by weighing the benefits and risks. During the use of drugs, it is necessary to detect relevant indicators, and if the condition changes, reevaluate the necessity and safety of drug use at any time. After taking Yasmin, there is always brown secretion in the private parts? Taking oral contraceptives can lead to some unexpected reactions such as vaginal bleeding, which is usually minimal and coffee-colored, often occurs during the first 1 to 2 cycles of medication. The specific reason for this is not clear. Some believe it is related to the amount of estrogen contained in the medication, as the chance of bleeding increases when the estrogen content in oral contraceptives decreases. Others believe that the bleeding is a result of the body adapting to the high-activity hormones in the medication, with the endometrium becoming thinner. Of course, there are some cases of bleeding caused by incorrect use of the medication or missing doses. Breast pain, nausea, loss of appetite, dizziness, and fatigue, similar to early pregnancy symptoms. These 3 reactions will gradually disappear as the duration of use increases. There are also other reactions such as reducing menstrual flow, weight gain, and skin discoloration, which generally improve after stopping the medication. If the woman in the text experiences vaginal bleeding, she should not be too worried as it is a common side effect of oral contraceptives, usually lasting 1 to 2 cycles and disappearing with longer use. However, in order to avoid secondary infections, it is not recommended to have sexual intercourse when experiencing minimal bleeding. Will taking Yasmin cause thrombosis in the brain or discomfort in the liver? The risk of venous thromboembolism, blood clots, is higher for users of oral contraceptives, birth control pills, compared to those who do not use the medication. This is mainly due to the presence of estrogen in the medication, and some studies have shown that the progestin component of the medication can also affect the risk of blood clots. As oral contraceptives have been updated and improved over time, the amount of estrogen they contain has been gradually reduced, and the risk of blood clots caused by estrogen has also been gradually reduced. The risk of blood clots is highest during the first few months to a year of use, but even then, it is still significantly lower than the risk of blood clots during pregnancy and the early postpartum period. As the duration of use increases, the risk decreases. For example, for a woman who has been taking the medication for 8 months, the risk of blood clots has actually decreased. Of course, recognizing high-risk groups for thrombophilia and other susceptibility factors, including smoking, obesity, older age and restricted mobility, is more important for preventing the formation of blood clots after medication use. Women with these conditions should seek the help of a doctor to evaluate the risk of medication use when choosing oral contraceptives. In addition to contraception, oral contraceptives can also be used to treat other clinical diseases, such as abnormal uterine bleeding can be used to stop bleeding and regulate menstruation. Endometriosis or adenomyosis can be used to relieve dysmenorrhea and reduce menstrual volume. Premenstrual syndrome can be used to relieve abnormal emotional symptoms, etc. When used to treat diseases, it needs to be done under the guidance of a doctor. Can short-term contraceptives be taken long-term? What are the side effects? For young women who are healthy and do not smoke, short-acting oral contraceptives can be taken long-term without a time limit. Because the risk of blood clots from contraceptives is mainly in the early stages of taking the medication, continuous use is better than deliberately stopping and starting. If the woman in question has infrequent sexual activity, condoms are a good choice for contraception, and regular use not only provides good contraceptive effect but also prevents some sexually transmitted diseases. When using condoms for contraception, in case of a mistake or failure, emergency contraception can also be chosen, but emergency methods should not be used as a regular practice. If oral contraceptives can be taken regularly, the contraceptive effect is also reliable and there is no need to add other contraceptive methods. Can short-term contraceptives be purchased and taken on their own? Where can they be bought? Oral contraceptives are over-the-counter drugs that can be purchased normally at a pharmacy. However, as mentioned in the details provided by the young woman in the question, it is important to note that if the menstrual cycle exceeds 2 weeks or if there is bleeding between 2 menstrual periods, it is necessary to seek medical attention and find the cause of the abnormal bleeding. Common ovulation disorders such as polycystic ovary syndrome often have the most common clinical manifestation of abnormal menstrual changes. Menstrual disorders caused by ovulation disorders can be regulated by gonadotropins or oral contraceptives, and which one to choose should be based on individual circumstances.